Have you found yourself staring at the ceiling at 3 a.m. again? That frustrating moment when your eyes pop open in the darkness and you just know that sleep has abandoned you for the night. I see you there, checking the clock, sighing as you realize it's happened again. The same time, almost every night. You're not alone. I'm Dr. Jessica Lee, and after working with thousands of patients over 60, I've discovered something that might change everything about your nights. What if I told you that this mysterious 3 a.m. awakening isn't just an annoying coincidence or just getting older, as many doctors might dismiss it? What if it's actually your body sending you an urgent message, one that most medical professionals completely miss? Today, I want to share something with you that might sound surprising at first. Those middle of the night awakenings that leave you exhausted and frustrated the next day, they're not random. They're not just part of aging, and they're certainly not something you should ignore. Let me tell you about Martha, a 67-year-old grandmother who came to my office last year. For months, she'd been waking up precisely between 3 o'clock and 3:30 a.m. She'd tried everything, sleeping pills, herbal teas, even cutting out her beloved afternoon coffee. Nothing worked. By the time she found me, she was exhausted, irritable, and beginning to wonder if something was seriously wrong. Everyone just tells me it's my age, she told me, tears welling in her eyes. But I know my body. Something doesn't feel right. And you know what? Martha was absolutely correct. Her intuition was telling her something that modern medicine often overlooks. Here's what most doctors get wrong. They treat these awakenings as the problem itself rather than recognizing them as a symptom of something deeper. They'll quickly prescribe a sleeping pill and send you on your way, but that's like putting a Band-Aid on a splinter without removing it first. What's truly concerning is that millions of older adults are living with this disrupted sleep pattern without understanding what their bodies are trying to tell them. And the consequences can be far more serious than just feeling tired. Did you know that consistent sleep disruption at specific times can be linked to increased risk of heart issues, or that it might be signaling hormonal imbalances that affect everything from your energy levels to your memory? Most alarmingly, these disrupted sleep patterns have been connected to accelerated cognitive decline when left unaddressed. I need you to understand something important. Waking up consistently at 3 a.m. is not normal, no matter what you've been told. It's not just aging, it's not just stress. Your body is trying to communicate with you, and today I'm going to help you understand what it's saying. The first thing you need to know is that your body operates on what scientists call circadian rhythms, essentially your internal clock. This clock doesn't just control when you feel sleepy, it orchestrates a complex symphony of hormones, body temperature, blood pressure, and more. When you consistently wake at the same time each night, especially around 3 a.m., your body is often responding to a disruption in these natural rhythms. And here's what fascinating research from sleep specialists at Stanford has revealed. Specific organs and systems in your body are active during specific time windows at night. Between 1 a.m. and 3 a.m., your liver is most active in its detoxification process. Between 3 a.m. and 5 a.m., your lungs and large intestine are doing their most important work. So when you wake up at 3 a.m. night after night, your body might be signaling an imbalance in one of these systems. It's like an internal alarm clock going off saying, hey, something needs attention here. But here's what I've discovered through my years of practice that most doctors never talk about. For many older adults, these 3 a.m. awakenings are directly connected to something happening in your body 12 hours earlier. Let me explain. Remember Martha? After carefully reviewing her daily routines, we discovered something remarkable. Every day around 3 p.m., she would have a cup of tea and a cookie, a small pleasure she looked forward to. Innocent enough, right? But what Martha didn't realize was that this afternoon ritual was creating a blood sugar spike followed by a crash. And then 12 hours later, her body would release stress hormones to correct that imbalance, precisely at 3 a.m. When we adjusted this one small habit, her sleep began to transform. Within just 2 weeks, those 3 a.m. awakenings became less frequent. Within a month, she was sleeping through the night for the first time in years. Now, I'm not saying this is the exact cause for everyone. Your 3 a.m. awakening could be signaling something entirely different. Some of my patients discover that it's connected to hidden inflammation. Others find it's related to their breathing patterns or an undiagnosed condition like sleep apnea. What I am saying is this: your body is infinitely wise. It's trying to communicate with you, and when you learn to listen, amazing transformations can happen. Now, let me share another truth that might surprise you. For many of my patients over 60, these middle of the night awakenings are connected to something called adrenal fatigue, a state where your stress response system becomes exhausted from being constantly activated. Think about it. Our bodies were designed for occasional acute stress, like running from a predator. But today we face chronic, ongoing stress, financial worries, health concerns, family tensions, political news that never stops. Our stress response never gets a chance to truly shut off. And when this system becomes depleted, one of the first signs is disrupted sleep, particularly waking between 2 and 4 a.m., when your stress hormones should be at their lowest. I know what you might be thinking. Great, another thing to worry about, but please hear me. Understanding this connection isn't about adding another concern to your list. It's about finally having answers. It's about reclaiming your nights, your energy, and ultimately your health. Because when you address these underlying imbalances, you're not just improving your sleep, you're potentially adding years of vibrant health to your life. So, what can you do about these 3 a.m. awakenings? Let me share some of the most effective strategies I've developed with my patients over the years. First, pay attention to what happens in your body 12 hours before your typical awakening time. What are you eating? What activities are you doing? Are you experiencing stress or strong emotions? Second, consider your blood sugar stability. Many of my patients find remarkable improvement when they add a small protein-rich snack before bed. Something simple like a tablespoon of almond butter or a few nuts can help stabilize your blood sugar through the night. Third, create a wind down runway for your nervous system. Our bodies need clear signals that it's time to shift from day to night. Try dimming the lights in your home 2 hours before bed, put away screens or use blue light blocking glasses. Create rituals that signal safety to your nervous system. One of my favorite recommendations is something I call the 3-3-3 breathing practice. When you find yourself awake at 3 a.m., instead of checking the clock or reaching for your phone, try this. Breathe in for a count of 3, hold for 3, and exhale for 3. Do this for just 3 minutes, focusing only on your breath. This simple practice activates your parasympathetic nervous system, the rest and digest response, and can often help you drift back to sleep naturally without medication. For Martha, this breathing technique became her lifeline on nights when she did wake up. It's like it gives my mind something to focus on besides worrying about being awake, she told me. Most times, I don't even make it through the full 3 minutes before I'm drifting off again. I've also found that many of my patients benefit from natural supplements that support healthy sleep cycles. Magnesium glycinate taken before bed can help relax muscles and calm the nervous system. Adaptogenic herbs like ashwagandha can help balance stress hormones when taken consistently. But perhaps the most powerful intervention is the simplest: consistency. Your body thrives on predictable patterns. Going to bed and waking up at the same time, even on weekends, helps to reset your internal clock. Now, I need to be clear about something important. While these approaches help many of my patients, persistent sleep disruptions can sometimes signal more serious health conditions that require medical attention. If you're experiencing other symptoms alongside your sleep disturbances, things like unusual headaches, significant weight changes, or new pain, please consult with your healthcare provider. Sleep apnea in particular is often undiagnosed in older adults and can cause these exact patterns of waking. A simple screening could identify if this is affecting you. What I want you to take away from our conversation today is this: your 3 a.m. awakenings are not something you simply have to accept as part of getting older. They're not random and they're not meaningless. They're valuable information from your body, and when you learn to interpret this information correctly, you open the door to deeper healing. I've seen patients transform not just their sleep, but their entire health picture once they understand what their body is trying to tell them. More energy during the day, sharper thinking, improved mood, even reduced pain and inflammation. One of my patients, Robert, a 72-year-old former teacher, put it beautifully. After working together to resolve his 3 a.m. awakenings, he told me, for the first time in years, I feel rested when I wake up, but more than that, I feel hopeful. I'd gotten so used to feeling exhausted that I forgot what it felt like to have energy. Now I'm playing with my grandkids again, I'm gardening again. I feel like I've gotten part of myself back. That's what proper sleep can do. It doesn't just add hours to your night, it adds life to your years. Your body has incredible wisdom. It wants to heal, it wants to thrive. Sometimes it just needs a little help remembering how. If you found this information helpful, please hit the like button and subscribe to our channel. In the comments below, I'd love to hear about your experiences with sleep disruptions and what's helped you. Your story might be exactly what someone else needs to hear. Next week, I'll be sharing more about how specific nutrients can dramatically improve your sleep quality, information that's particularly important for adults over 60. Until then, remember, your 3 a.m. awakening isn't just a problem to solve, it's a message to decode. And when you listen to what your body is telling you, healing becomes possible in ways you might never have imagined. Thank you for joining me today. I'm Dr. Jessica Lee, wishing you restful nights and energetic days ahead.